Hi, I'm Greg Nardine. I am a licensed massage therapist. I'm the head massage therapist at Healthy Ways Wellness Center. I am also a faculty member at Cortiva Institute for Massage Therapy in Westport, Connecticut. And I'd like to talk to you today a little bit about how massage therapy can help with pain management. Looking at it as a generality, massage is going to help with pain management in two main ways. Number one would be treating the pain, the symptom itself, which it can do very well. And also the second would be treating the cause of the pain, which depending on what the cause is, massage can be very effective that way as well. Now, there are different layers, different ways that massage can affect the client on the table as the massage is being performed. We'll call those mechanisms of massage, and massage can affect the pain being felt by the client in several different ways. The first is a mechanical effect, and that, put simply, are the changes that are the direct result of what the therapist is doing to the client. That would be something like breaking up scar tissue or adhesions in muscle or fascia. Lymph drainage would be another example, and it's something that's happening at the exact spot that the therapist is performing at. Now, how could that affect pain? Keeping the body running the way that it's supposed to. It's like preventative maintenance, right? Like you change your oil in your car. If you keep the body functioning the way that it should be functioning, chances are the pain should reduce, just everyday pain. The next type of mechanism is physiological, and that is still something that's happening because of what the therapist is doing, but now we're talking about things happening on a systemic level. If we think about the parasympathetic nervous system, which is rest and digest as opposed to the fight or flight that you may have heard of. If you're in an intense situation, fight or flight takes over, adrenaline starts pumping, the heart rate goes up, breathing increases, blood pressure goes up. Massage is going to cause the exact opposite effect in a client. So blood pressure will lower, breathing slows down, digestion will increase, and just those relaxation responses can certainly help to ease the pain that a client might be feeling at that time. Another physiological effect could be the reduction in cortisol, which is the body's stress hormone. So obviously we want to reduce the amount of cortisol which is being produced, and also increase the number of endorphins, the body's painkiller, the natural painkiller that are circulating in the body. So these are all physiological effects that can help a client deal with pain. The next would be a reflex effect. And this is similar to a physiological effect. It's generally triggered by the sensory receptors of the nervous system. And that can trigger muscular relaxation, which is obviously a good thing. It can also disrupt the pain cycle, which simply put is when your body is in pain, that area will spasm up. Those muscle spasms will cause further pain, which cause further spasms, and it kind of goes back and forth in kind of an endless cycle. So being able to disrupt that can stop that pattern from happening, reduce the spasms, and rid the client of all that excess pain that was created through that pattern. Another, which is similar to the pain spasm pain, but deals more with the body trying to immobilize itself, and that's called muscle splinting. And obviously reducing muscle tension will help that as well. What muscle splinting is if there's a joint, an area in the body which is in pain when you move, your body tries to stop you from moving that way. So therefore, muscles in an area will tighten up, which now is going to cause additional pain to whatever the initial problem was. So being able to break up that muscle tension and keep that range of motion optimal will certainly help in pain reduction as well. Now, another reflex effect, which is pretty amazing, is the neural gating mechanism, which massage can trigger. What this is there are the sensory receptors in the body. There are ones that will send messages of pain to the brain. Others are just sensory touch messages, temperature messages. Anything that your body is feeling is going to get sent to your brain via this network. There is a priority to which signals get to go first, though. And so if you think of a train track, like a Y-shaped train track with a changer in between, the sensory information gets priority over the pain signal, and therefore when the sensory of getting a massage, the same signals are getting sent to the brain, that track switches over and the pain messages can't reach the brain anymore. So that's kind of an interesting way that massage is able to block a pain signal just from the sake of getting a massage. The last mechanism I want to speak about is the body-mind effect that massage can have. And certainly when you're in chronic pain, you're going to be miserable. It's going to affect your mood. Psychologically, there are psychological issues that can manifest as physical pain as well. So there is a connection there, and massage can certainly address those issues as well. Massage has been shown to be able to reduce feelings of anxiety and depression, add to mental clarity, or give an increased feeling of well-being to a client. And certainly if you can eliminate the psychological the distress that you're in psychologically, that will certainly help to reduce the pain that a client is having at that time. As far as, so these are all different ways that massage are able to affect a wide variety of pain-causing issues, what have you, whether it be illnesses, injuries, post-op pain, psychological problems which are manifesting that way. Certainly massage can help in many different ways. As far as my practice at Healthy Ways, the treatment room is widely adjustable for whatever clients need. It's wheelchair accessible. Client positioning is, we can certainly work in many different ways. Table heights, different bolstering. Not everybody can lay flat on their stomach or on their back for the entire time. Certainly session length is another thing that can be adjustable. I've done 30-minute sessions, I've done 2-hour sessions. Different clients will need different things, and certainly the frequency of sessions as well, which normally starts with issues of pain management pretty often, and depending on how the client is responding, sometimes we can spread those out a little bit as well. So certainly I look forward to speaking with you if you have pain management issues, no matter which, what might be causing those, and looking forward to working with you for finding a solution.